another thing which is for comprehensive ophthalmologist is acute chemical injury, and how should we manage, because it's a true ocular emergency, and it can be because of acid, because of alkali. Acid, we all know, causes denaturation of proteins, so the percolation of acid is less. Alkali causes more devastating injury because it causes cell lysis. And the aim of management is to prevent the long-term sequelae and complete removal of chemical from the eye and control of acute inflammatory reaction. And the prognosis depends on how rapidly the initial therapy has been done and how rapidly you have removed the chemical. So the management includes immediate management and early management, and the immediate management is irrigation for at least 30 minutes. Now 30 minutes comes because many people don't have a pH paper. That's why on an average you use 30 minutes. But the best thing is you should use pH paper, and you should check that the pH is stabilized. And that should be done once you have done the complete wash, and you wait for 5 minutes, because if you immediately put the pH paper, the pH will appear falsely stabilized. But if you wait for 5 minutes, then if there is any chemical there, that will get released, and then you will get to know exactly whether the pH has stabilized or not. So this is how you keep washing. You put Paracane eye drops and wash, evert and see, wash everywhere. And then after waiting for 5 minutes, you check pH has stabilized. That is absolutely fine. You can use anything, you can use, but the best thing studies have shown is balanced salt solution, but because of cost, many times you can use any other thing. What is another important thing is a double eversion of lid, and this is the correct way of doing double eversion. You do first single eversion and then double eversion, and then you ask the patient to look down. That is very essential, so that now you can see how the visibility has gone up to the fornices, and this is very important to remove the chemical completely, because that is the main aim of management. And then once you have removed the chemical, the idea is to promote epithelialization and control inflammation. And for that, you have to assess the severity of injury, the severity of epithelial defect, the severity of limbal ischemia, and of course you grade the severity of injury. Now grading is not done just for theoretical purpose. The basic idea is to know what is the prognosis and explain to them. So this is the old Roper Hall classification wherein the grading was done, but grade 4 includes more than half of limbal ischemia, where you can have a lot of variability. You can have 200 degrees of limbal ischemia, you can have 270 degrees of limbal ischemia, you can have 360-degree limbal ischemia, and these have different prognosis. So that is why this Dua's classification, which is classified grade 4 into 4, 5, and 6, has a better prognostic value. Then if there is any necrotic material, you debride that, you put the patient on analgesic, antibiotics, lubricants, and topical steroid is essential for the first 2 weeks. It may look very ominous and whitish kind of, but then you may be scared of using steroid, but steroid is very essential for two weeks at least. And then sodium ascorbate, sodium citrate, depending upon the damage that is there. Autologous serum has been found to be effective, as well as the umbilical cord serum, but autologous serum is more easily available because you can use the patient's own blood for making it. Now sometimes when you see that the chemical has been removed from the surface, but sometimes some chemical percolates inside, penetrates through the conjunctiva, and you can see the depot, small depot of these chemicals. So you have to remove the chemical. If it is at all there, then it will keep causing damage. So you have to remove the chemical completely, and then once you have done it, see with all these chemical particles and charred particles also, because charred particles also release collagenases, and then you have to remove all these elements so that and further put an amniotic membrane over it so that you can have a good ocular surface. Now, amniotic membrane, as I said, is a useful tool in acute chemical burn, and it has been found that it reduces pain and it promotes epithelialization. Now, this is the amniotic membrane that is being put in a case of an acute chemical burn. I'll just move fast because of paucity of time. And this is how it looks like, the post-operative picture. And studies have shown, and we have also done at the RP Center, that it reduces pain and it promotes epithelialization in acute chemical burns. Now, sequential sectoral conjunctival epithelectomy is another thing, because what happens that there is a damage to the epithelium, then there is risk of conjunctivalization. So in order to remove the conjunctival epithelial cells moving onto the cornea, you have to keep removing those cells so that the limbal epithelial cells from the surrounding region, they take over, and there is no conjunctivalization or minimal conjunctivalization. Tenoplasty is another thing which is quite useful in cases of limbal ischemia. If you have limbal ischemia, you can use tenons in that area, and that improves the ischemia. It results in vascularization in that area, and it is quite useful. So management depends on severity. In grade 1 and 2, you use lubricant, ascorbate and citrate. In grade 3 and 4, you use amniotic membrane, umbilical cord serum, or autologous serum if you have it. So I would like to conclude by giving this message that prevention is the best thing as far as acute chemical burn is concerned. If you have acute chemical burn, you should prevent damage, and for that you have to remove chemical by all means, by washing, by checking the pH, by double eversion, by even doing a conjunctival dissection and all that. So these are very essential. And another thing is that we need to have mass education regarding this, because this is a very common thing which we do encounter in every part of the country and every part of the world. And for this, mass education and appropriate legislation is important, so that people do have less chance of damage caused by chemical burn. Thank you very much, and I would like to have your suggestions and comments on this.